Hello, everybody. My name is Michal Linial, and today I'll be discussing a predictive model for endometriosis. This study was led by Ido Blas from my lab with a few partners that are listed here. So what it is all about? Endometriosis is a condition in which the endometrial-like tissue is found outside of the uterus. And as you can see here in the scheme, there are many lesions in the pelvic tissue that can cause really a complicated chronic disease in which the symptoms are quite diverse, but they are all including inflammatory conditions, severe pelvic pain, infertility, but many more like fatigue, depression, and so on. So overall, it really has a significant impact on life quality. So the difficulty in diagnosis is listed here because the lag between symptom to diagnosis can be 4 to 11 years even now. More importantly, the diagnosis itself is done by a surgical procedure, and there are very few non-invasive techniques and no biomarkers. So it's not that rare, actually. It is affecting 6 to 10% of women throughout the globe in their reproductive years. And so it's a big issue from public health. And there is, in the recent years, increasing awareness and research, but still many open questions. Just to wrap up this introduction, I should also say that 68% of the women that have endometriosis were initially misdiagnosed, which is an unbelievable number. So in order to understand or to learn about endometriosis, you have to see what are the factors affecting it or the mechanism underlying it. And the reason the current status is that we know a lot about that there has some impact on inflammation, oxidative stress, some environment, steroid hormone, but we know very little about it. So the research goal was to revisit current knowledge on risk factors and to see what can we say. And we did it by an approach of machine learning approach in which we include data to learn about the model. And the data is for biobank, specifically the medical records with self-reporting, with lifestyle, genetics, and medical images, which we have not used in this case, but we're talking about 500,000 patients or women, or about half of them are women. So this is the analysis. And the first thing we did, we collected all risk factors known today, and we see how the univariable analysis can be studied. And to our surprise, we found that many of the known factors were not seems to be affected in this cohort. So instead, we use everything that we know from this cohort, which is over about 6,000 patient women with European origin, and 7,000 if we ignore the ethnicity. And when we did this, we built up a few models from genetics, from diagnosis, and from known risk factor, and we combined them all. What was a bit disappointing is that the PRS, the genetics, was very little, basically nothing. So it failed to explain the variance in population. So in order to do better, we learned the EMR from those patients, and we were able to find some aspects that are really very prevalent in those affected and very with a big difference statistically. So there are quite a few of ICD-10, which is the diagnosis index, that tell us something about the prior of having endometriosis. When we analyze this is just to show that the number of diagnoses prior to the diagnosis of the endometriosis became to be a very important feature. We built a model, we checked the performance of the model, and we were able to show that the model boosting the AUC is quite nice, and we are able to show that XBoost and CatBoost are the best in providing the highest stable output. So just to say that we learn about some features. I don't have time to discuss it, but I'll do it in the poster. And to summarize, we have new insight on endometriosis. We were able to work with clinician, which was very important experience, and we have reframed the risk factor known today, and also we show that all ethnicity behave the same. So I'll stop here, and I'll just say that this paper was just published last week, and I would be happy to discuss more on this project. Thank you very much.